police forces are warning they will take tougher action against those who do not comply with the coronavirus restrictions in England and Wales. The head of the National Police Chiefs Council said there'll be more officers on patrol to crack down on those who he called dangerous, selfish and totally irresponsible in the face of the current health threat. The Home Secretary, Priti Patel, has thanked the majority of people for complying with the rules, but blamed a minority who she said were putting the health of the nation at risk. She said the current rules are tough enough, but under constant review. Here's our Home Editor, Mark Easton.
Visitors are not welcome at the seaside. Southend's beachfront car parks are locked, peaked caps patrolling the shoreline. With people restricted, the rats are enjoying new freedoms. This tourist town doesn't want non-locals coming for a constitutional.
They shouldn't be coming, they shouldn't be travelling. I think they should define what local is for the exercise. Because I heard the concern about Boris Johnson yesterday going from Down Street to the Olympic Park.
What really irritates me is I hear minister after minister say don't go out. They don't follow it except for your exercise.
The news that the town's hospital is struggling to cope, close to running out of oxygen yesterday, has contributed to the sense of emergency. Most people do seem to be obeying the rules. Southend looks like a place in lockdown. It feels as though the mood has changed in the last couple of days. Police say they'll be quicker to fine rule breakers. There's strong public support for tougher enforcement and tighter restrictions as the appeals from health professionals become ever more desperate.
We need to really focus on what the enforcement issues are. So if the legislation was a lot tighter, it will make it a lot easier for our colleagues in the police force to enforce what we're asking them to do.
Home Secretary, we're warned we may be facing a health service catastrophe. So why are the rules of this lockdown not as tough as they were last spring?
The rules are actually very simple and clear. We are meant to stay at home and only leave home for a very, very limited number of reasons.
That didn't answer the question, of course. The concern is not about the clarity of the restrictions, but their strength. Pressed on the point, the Home Secretary later said she thinks the current rules are tough enough, with police issuing tens of thousands of fixed penalty notices and fines.
The size of the party and the lack of engagement from people here, you are going to probably end up with up to a £10,000 fine.
Our successful staged enforcement approach remains, but we will not linger on encouragement for those who are choosing to break the rules. The rules are clear and we need to abide by them if we are going to protect the NHS and save people's lives.
Psychologists advising the government say getting people to obey the rules may have less to do with confronting lawbreakers and more with a focus on those who are following the guidance.
If you tell people everybody is doing this, stop it, actually what happens is what people hear is everybody is doing it. It begins to set a norm. It tells you if everybody else is doing it, why shouldn't I? And so it undermines the behaviour.
Positive COVID tests in Southend have been falling in the past week, but 55 people from the town have also died from the disease in the last 7 days. What happens next is a matter of life and death. Mark Easton, BBC News, Southend.
Our Deputy Political Editor, Vicky Young, is in Westminster. So the Home Secretary says the rules are tough enough, but constantly under review.
Yeah, and I think the message from the government is shifting this week, and there are various elements to it. The first is trying to get across to people the perilous state we're in, particularly, of course, the rising number of deaths and the pressure on the NHS. Then they're talking about those breaking the rules and that suggestion there that the police will move more quickly from just warning people to actually fining people, really trying to shame people into doing the right thing. And then the third element is more nuanced. It's about personal responsibility, saying to people, yes, there are lots of reasons why you can completely legitimately leave home, but please think very carefully about that. Do you really have to order that parcel and go and collect it? Do you really have to go and see that friend? Cut down on those personal contacts. And then the big question there, are these rules tough enough? Well, no one will know that until they see a consistent fall in the number of cases. That's what everyone is desperate to see, but it's also why nobody is ruling out tighter measures.
Vicky, thank you. The pandemic caused excess deaths in the UK last year to rise to their highest level since World War II. Official statistics show there were nearly 85,000 more deaths in 2020 than would be expected, a rise of 14% Our health editor Hugh Pym has been talking to one woman who lost her husband at Christmas.
He was kind-hearted, ambitious, strong, and he always thought about other people.
Lisa remembers her husband Adrian, who died on Boxing Day with COVID. He was 55. He had previous health conditions, but doctors said they were not a factor as the virus gripped his lungs and he passed away in intensive care.
Adrian is not a statistic. He's not a number. He was my husband. He was family's son, a nephew, a brother, friends to many. And he was well known in our community because we had a business as well.
Every COVID death is tragic for loved ones. The statistics do make bleak reading, not least at a time of lockdown and concerns about the spread of the virus. One measure of the overall impact of COVID-19 is the total number of deaths from all causes, set against what might be expected. There were close to 697,000 UK deaths in 2020, more than 84,000 above the average in the previous 5 years. That's a margin of 14% above that average. So how does that compare with previous decades? Well, it was the highest in 75 years. And remember, each year is compared with the previous 5, reflecting medical knowledge and population health at the time. As army personnel joined the vaccination effort, there are hopes that once enough jabs are carried out, fewer people will become seriously ill with COVID. But before that happens, there are warnings of more grim news to come.
People who are dying now from COVID-19 are people who will have been infected well before Christmas. And given that we know that cases have been going up since the beginning of December, we can expect to see deaths to go up as well for several more weeks to come.
Older people are most at risk. The highest number of COVID deaths in England and Wales have been among those who are 85 and over, followed by 75 and over. But Lisa wants all adults to realise they could be vulnerable.
It can affect anybody. I'm 45 and I was bedbound for 2 weeks with it and I got through it. But Adrian was 55 years of age. He was so young and we had so much still planned. And people need to take note.
Above all, Lisa says the public must know the heartbreaking consequences of letting the virus spread. Hugh Pym, BBC News.
The latest government figures show there were 45,533 new coronavirus infections recorded in the latest 24-hour period, the second fall in 2 days. It means, on average, the number of new cases reported per day in the last week is 55,653. Across the UK, an average of 32,520 people were in hospital with coronavirus over the 7 days to Sunday. 1,243 deaths were reported. That's people who died within 28 days of a positive COVID-19 test, and it's the second highest figure of this whole pandemic. On average, in the past week, 985 deaths were announced every day. The total number of deaths so far across the UK is 83,203. And the UK has now started a programme of mass vaccinations. 145,076 people have had their first dose of one of the 3 approved COVID-19 vaccines in the latest 24-hour period, taking the overall number of people who've had their first jab to more than 2.4 million. Well, Hugh Pym is with me now. Let's talk about that fall in the number of new cases. How significant is it 2 days in a row?
Yes, Sophie, 2 days below 50,000. At the end of the last week, it was up at about 60,000. And the crucial 7-day rolling average with the trend, that's fallen now for 3 days. So could this be the first sort of reaction to lockdown restrictions imposed over the new year? Well, it's probably a little early to say that there's a firm trend here. We'll need a few more days of data, but it is very interesting. In Scotland, Wales and Northern Ireland, cases have all fallen slightly. It's the same in London and the southeast of England, only a very small fall, but there have been increases in other parts of England, particularly the northwest, which I think is a concern. But hospital numbers up again. The daily death toll, the second highest on record. Those are all lagging indicators. They, as we heard earlier, reflect cases that were first picked up, infections a couple of weeks back, and they are likely, as we've been hearing, to carry on rising for a little while yet.
Hugh Pym, thank you.